video, we're gonna be making a newborn assessment and I'm gonna be using my doll. So, first things first, bago natin gawin ang newborn assessment, make sure na nakapag-hand hygiene ang nurse para maiwasan ang contamination kay baby and also wear gloves para syempre, mapanatili nating ligtas si baby pag in-examine natin. So first, bago natin i-examine ng baby, alisin natin yung blanket na nakabalot sa baby and then yung head cap. Before you start, introduce yourself to the patient and state what you'll be doing. Since baby o newborn ng ating pasyente, sa mother tayo magpapakilala o sa kung sino man ang kasama ng baby, either kay mommy or kay daddy. You can start by saying, "Congratulations, Mrs. Bautista. I am Nurse Kyla and I would like to examine your child for further newborn examination." And then, syempre kapag pumayag ang mother o kaya kung sino may kasama, carefully place the baby into the examination table. For the physical assessment, dito natin kukunin yung kanyang weight, length, and head circumference. Dito, gagamit tayo ng tape measure para ma-measure ang weight, ma-measure ang length, head circumference, and chest circumference ng baby. So, we're gonna be measuring the head circumference of the baby. Gagamitin natin ang sukat na cm. Okay? And then, pag maglalagay tayo ng tape measure kay baby, make sure na dahan-dahan natin ilalagay kasi sensitive ang balat ng baby. Okay. May measure natin yung above the eyebrows. Okay. Sunod, measure natin yung baby's length. Pag nagme-measure tayo ng baby's length, make sure na may extend natin ang kanyang paa. Next, the chest circumference. So, pag measure natin ng physical assessment, gaya ng chest circumference and head circumference, make sure na hindi natin i-slide agad yung tape measure para maiwasan natin masugatan ang baby. And then, dahan-dahan natin siyang iangat and then ibababa. For the initial assessment, first is the identification. Identify the baby's sex, mother, registration number, and the baby's name. And then the gestational age of the baby. Sa pagkuha ng vital signs, ang gagamitin natin ay ang bell ng stethoscope. And then, before natin gawin, i-rub muna natin ang stethoscope sa ating palm para hindi malamig pag nilagay natin kay baby. Assess how the baby looks, see their color, make sure they don't look jaundiced, which is the yellow color, and make sure their tone looks okay and not super floppy, but at the same time they're not super tight, that they are not absolutely losing their mind and unable to be consoled, and inspect their skin to see if they have any lesions, if they have any birthmarks. Then reassure the parents on and make note of them. That way they can be monitored. But the basic idea here is to get a general overview of the infant, and then lastly, check the baby's umbilical cord. Dito siya dapat. Make sure it doesn't look infected, that is drying out well, and then educate the parent to that point too. Do not put anything on the umbilical cord, and then leave the diaper down below the umbilical cord, and don't give them a bath until it is fallen off, and don't encourage it to pull the umbilical cord if you see it dry and hanging. Let it fall off on its own within a week or two. So assuming that we have gloves on our hands, so assess for the palate. Let the baby suck your finger. And then, pag nasa loob na, touch natin ganon. Touch natin yung hard palate niya and then soft palate. Assess if there's a presence of cleft lip and cleft palate that you can do by just sticking around a gloved finger into their mouth and feeling the roof of the mouth and making sure that it is intact. And you can feel and visualize if the baby does or does have any. Does not or does have any rather. And it is also a good time to assess their suck, swallow, breathe, reflex, and coordination. So you can just wiggle your pinky around and see, do they have a strong suck? Do they have a weak suck? Does it seem to be somewhat coordinated? Are they choking on your finger? Assess anything like that while your fingers inside the baby's mouth. And then let's assess for the ears. The top of the ear should be aligned to the eyes. Look at the eyelids if it is intact and feel the baby's frontanel. Dito sa back and then dito sa front. So for the frontanel, are going to be the gaps in the skull, and newborns will have an anterior frontanel. It's an open area and you want that to be flat. If the frontanel is depressed, it could indicate dehydration. The frontanel at the back is usually much smaller than that's gonna close up within the first few weeks of life. Whereas the anterior, the one in the front, that is going to be open for at least 9 months until 18 months. And educate parents on that because that's a delicate area, but it's also okay. And remind them that if this ever gets really sunken and doesn't feel flat, that could mean the baby is getting dehydrated. And look at the shape of their head and make sure it looks symmetrical. So remind the parents to offer assurance if their head is a little bit in a cone shape, and that's just from being in the birth canal, and that will shape out because it's something to monitor and encourage parents to take pictures of the head from top down and from the sides, and that way in case their head doesn't really show to get back into the round shape, we know we can monitor it and they can always go for cranial molding if that's needed. Okay, next we will look at the baby's mouth. Okay, kunyari, ayan, naka-open yung mouth ng baby and then say, kunyari, ganyan. Habang umiiyak, ano natin, ganon. Hindi pala sumasagot sa yung baby. So, ayan, we will take a peek in the mouth. Okay, gawa na. Note for any Epstein pearls. Check the lips and make sure that they can flange out, and make sure that her tongue also, when the baby sticks out his tongue, and you can play with their mouth a little bit and see if he'll do it. You want to be able to, if you can visualize her tongue coming at least past their lip line, and that's gonna help ensure that he's gonna have an effective suck swallow, and usually you do that by just playing with his lips. Okay, for the red light reflex, gagawin natin, kunyari ito yung ophthalmoscope. So, dito tayo titingin para, ayan. Then, titignan natin kung makikita natin ang red light reflex ng baby. So, yan. We assess their eyes to make sure that their eyes does not look yellowed because again, that could indicate jaundice, and make sure that the red light reflex is present. So you do that by using the ophthalmoscope. You want to see a red circle of light in their eye on both sides, and that could indicate a red light reflex. If they don't have it, that could indicate a corneal problem or retinal blastoma, which is the huge thing you do not want them to have, and this is an emergency referral. And then let's take a peek in their chest just to make sure that their chest cavity look okay and symmetrical. Check for their heart rhythm, just making sure they don't have heart murmurs. Listen to their lung sounds a bit. listen to their belly. Remember to listen to their belly before you feel it. And we're gonna be using the bell of the stethoscope when we listen to this. So let's move on to the diaper area. If this is a little boy, make sure both of the testes are descended, and on both little girls and boys, assess their genital area and make sure that there is no obvious abnormalities present. And then assess for any hip dysplasia. So there we will be using two tests, and the first test is the Barlow, and that you just start with this out, okay, sa middle, and then pull. Kapag may feel tayo na pop, that could indicate a hip dysplasia. And the second test is the ortolani. Okay, start with the feet together. Okay, in the middle, and then bend 90 degrees and pull towards you and out. Sides again. And then if positive, mafe-feel natin yung pop sa kanilang hips. And if hip dysplasia is present, send the infant for an ultrasound for their hips to see. And next thing we're gonna do before we move on to the reflexes with the baby is just to make sure that their extremities are not floppy, but they also don't have too much tone, and the tone is what would be if they were really tense. So with him, you can see, you can pull his limbs out, and he'll bring them back, and you'll be able to stretch everything out. And again, he will curl up, and that's a type of tone you would like in the newborn to see. Then obviously, just make sure to check if the baby has complete feet and hand fingers. So assuming that we have 20 fingernails and toenails. So for the reflexes, there are 5 primitive reflexes, and we assess this because if the baby is lacking them, it would be a problem with the central nervous system. First is the rooting reflex. Okay, you can stroke the corner of his mouth, and you will see if he turns his head to where I'm stroking, and rooting reflex will last until he's 4 months. Okay, kunyari, iyaharap ko dito ang baby, gaganon ko yung kamay ko. Ngayon, si baby, susundin niya din yung sa kamay ko. Then kapag nag-side ako dito, sa side din yung face ni baby. Okay? Then, the suck reflex, kaya nung ginawa natin kanina, nag-chinek yung palate niya. So, papasak natin yung daliri natin ganyan. Titignan natin kung gaano ba ka yung swallowing reflex, suck reflex ni baby. And then, sa tonic reflex, if you turn your head, my baby should stick their arm out. Pag tinurn natin ng ganon, syempre magre-react si baby, gaganyan ang kamay niya. Diba? Nakaganyan lang siya. Pag tinurn natin ganyan, gaganon yung kamay ni baby. And then, the neck reflex, and it should last until about 5 to 7 months. Ito yung nakikita natin pag si baby, nakaganyan lang siya, minsan lagi, and then minsan nakaganito siya. Okay? And then, the grasp reflex, ito yung kapag nilalagay natin yung kamay natin dito sa daliri ni baby, hino-hold nila yan. Parang ito yung holding hands between mother and baby. Okay, the next is stepping reflex. Okay, hold the baby up. And then, up and down, parang magwawalk sila. Itatouch nila yung solid ground na yan. Parang, yan, ganyan. Okay? And then, lastly, di pa pala last, may isa pa. Moro reflex, ito yung parang gugulatin natin si baby. Then if the baby splayed their arms up really quick, that is a good way to assess this one. So, parang kaganyan si baby, and then gugulatin natin, parang napapagano si baby. Okay, monkey. So, lastly, this is not a primitive reflex, pero ginagawa to sa mga baby, and this is the Babinski reflex. Ito yung kakalitin natin yung paa ng baby, and then titignan natin kung mag-react yung paa ni baby. And then, one last reflex to examine the baby's back is to put them over your arms, like this, and stroke. Okay. And stroke the side. Kunyari ito. Then mag-curl up si baby. Papunta dito. Okay? And then dito naman, pag ganon na mag-curl naman si baby, pag ganon. Okay?